This conference will now be recorded.
Good afternoon. This is the Bicycle Pedestrian Advisory Committee. We have enough people for a quorum. It's 2:30. I'll call the meeting to order. And next slide. Yes. Yep. Oh. Opportunity for public comment. Anybody online?
There's not.
No.
She's going to be online.
Oh.
So you can still introduce this staff update and then say what was done.
The staff, agenda item number 3, the staff update by Hope. Should be on.
Hi, good afternoon. Can everyone hear me okay?
Yes, you're very loud, Hope.
Okay, I will move away from my computer a little bit. I normally do not get that comment of being very loud. So the first few things on the staff update is you can see on the slide in front of you guys, the meeting's out until March, until our next BPAC meeting, which will be March 13th, hopefully at our normal meeting time of 9:30 a.m. But if you're interested in participating in any of our other KTMPO meetings, those are listed in front of you for the next couple months. Next slide, please. First, couple other things that have been happening. As you guys know, TxDOT has a BPAC meeting, and so a few updates from their meeting that was happening in October was they're doing the TxDOT statewide active transportation plan, and they discussed some outreach techniques that were happening during round 1. And during this next round, they had some meetings in Austin and Waco in November, and they got some pretty decent turnout from those meetings as well. They did not display any of the information they gathered at those meetings. They also discussed some micromobility upcoming technical advances that they could be implementing into this plan. They also gave an updated schedule for anticipated public meetings and an adoption date for this plan of spring of 2025. So there's still a lot of time and development for this plan if you're interested in getting involved and giving your opinion. This is also in connection with the Connecting Texas 2050 plan that TxDOT is working on, which is a statewide long-range transportation plan. They gave an updated timeline for this, which should be adopted by summer of 2024. They presented some draft goals of safety, preservation, mobility, connectivity, economic values, and stewardship, which is all things that they've heard from the public meetings. And then one other thing that I wanted to highlight from this meeting is the TxDOT 2023 Transportation Alternatives Program. They broke down all the projects that they got. They received 312 projects during this last project call, and 222 of those was from unique and different project sponsors, so 222 different locations submitted projects. All of these projects combined totaled $1.4 billion in federal funding. After selection and rubric scores, they selected 83 projects totaling $345 million, and 5 projects selected were in our area, and those go to the City of Hamilton, the City of Holland, the City of Little Rivers Academy, the City of Morgan's Point Resort, and the Village of Salado. And we have one other project in the region that we serve, which is the City of Thorndale, also received a project. And if y'all are interested, there's a full list of awardees and what the projects are going to be going towards and the amount that each city received for these projects. And I can send that out in a follow-up email. The next meeting that TxDOT will be holding for their Bicycle Pedestrian Advisory Committee will be posted hopefully soon. They haven't sent out their FY24 calendar, but it should be meeting in January. They normally meet at the end of the month. And I will send out an email letting y'all know when that meeting is happening when they have posted it. One other thing in our staff update is KTMPO is working on their public engagement plan update for 2023. Anita has been working very hard on that and getting that out there. We're soon going out for public involvement for this plan. So if you're interested, please reach out to Anita or us to get those dates when we'll be out for the public meetings. Next slide, please.
Excuse me, Hope.
Yep, what's up?
I was wondering, do you have any more information about like the projects that won in our area and what they look like?
I do not have that information in front of me, but it is in the website link that I can send out in the chat and also in a follow-up email. That information that TxDOT has put together for the Transportation Alternatives Program lists the amount they got, what the project is going towards, and a brief description of all of the projects that were submitted and got awarded money.
Okay, thank you.
I can tell you Morgan's Point got a shared use path near the new Lake Belt High School on FM 2043. I can't remember the cost. It basically starts from the school and then heads west to connect down into the center of town. So they were successful on their application.
Thank you.
Alrighty, as I say, the air quality readings for the month of November were both 49 for Killeen and for Temple monitoring stations. Is there any other questions about the staff update?
I don't think there's any other questions for Hope.
All right, thank you, Anita.
Okay, next item, it's an action item regarding the approval of the meetings from September 27th.
Make a motion to approve.
Motion to approve. Second. Yeah, all in favor? Aye. Aye. The nays? Nobody? So the meeting minutes are approved. Next item is a discussion item. And I'll turn it over to Anita.
Thank you. Today we have the opportunity to hear from Sarah Wheat with McLane Children's Medical Center of Baylor, Scott and White in Temple. Sarah is the trauma program manager for the Level 2 Trauma Center, McLane's Children's Medical Center in Temple. She's been a nurse for 15 years. She's working in critical care areas before moving into her current role in trauma services. Sarah is passionate about injury prevention, education, quality care, safety, and process improvement for patients and community members alike. She sits on the board of the Central Texas Regional Advisory Council, representing the lead pediatric facility in our region. Sarah and her husband, a retired Army veteran, have 5 children and 8 grandchildren. And when she's not at work, you might find her on a paddleboard or driving in her Jeep.
I was told to provide a transportation mode, and those are my favorite. So
Thank you.
I do walk and I do occasionally. Is it just up?
No, to the right.
To the right?
There you go.
Okay. So like she said, thank you for that introduction, Anita. My name is Sarah Wheat. And so I've had the pleasure to work with Anita 2 years in a row at our annual Safe Kids Day and Rodeo held at McLane Children's. And this year I got the pleasure of working also with Gary and Lisa at Trend Country. So lots of folks that know us and have worked with us together here. So I just wanted to come today and talk about our Safe Kids Day and why we're doing it and the importance of it. And Anita had asked me just to present some of the data that we had from the event. So I have no disclosures. Okay. So our program, the trauma program, the way they are built is the American College of Surgeons determines that we must also have an injury prevention program embedded in our trauma program because the best way to handle trauma is to prevent it from happening at all. So there's a lot of emphasis on injury prevention. And so we try to prioritize what injury prevention measures or things that we're going to do based on our data, what happens in our area. So like we don't necessarily have as many gunfire injuries as there may be in other bigger city. We have other injuries like horses and wolves that they obviously don't have. So we pay attention to the data and we try to do injury prevention about that. Our requirement from the American College of Surgeons is that we execute 2 community-facing activities and that we participate in national injury prevention efforts. So by the numbers, these are the top 5 injuries in our area. We collect all this data from in 2022. These were our top 5. So you don't see a lot of bikes and pedestrians here, but I'm going to tell you it hits the top 10. So I'm going to show you on this next slide. I deducted some of the numbers, but you can look at the bottom. There's like the general numbers in there. And if you see, bike and pedestrian is kind of the middle of the road for us. Included in bike and pedestrian is you'll see that bottom number that says fall. I hope y'all can see that. It's kind of small. It's around 225 patients, and in that category is scooters. So we have a lot of scooter injuries there from kiddos, and so that we see a lot of kids that come off or ejected off of the scooter. You'll also notice on there it says ATV. That's one of our high ones, which that kind of falls into that roll category that this committee addresses. And then we also have there's another one that I felt like was
Horse.
Other vehicular would be like a golf cart, or not a golf, yeah, not a golf cart, a go-kart is what I'm trying to say, a go-kart. So these are the 19 categories that we collect, so we have to kind of try to buttonhole the injuries into these categories. So we pay a lot of attention to how kids are moving and then come off of those devices or if they're walking.
Sarah, what's the age group there?
So we see patients under the age of 18. So 0 to 18 is what we capture. I would say in that data set, those injuries are happening in school-age children. So we're seeing kids that are right around that 7 to about 13 in that category. So this year for our annual bike rodeo, we had 144 volunteers. I'm going to show you a picture of the volunteers. It was pretty impressive. And I don't even think we actually captured Anita. She had maybe not made it to the picture yet. I don't know. But
I'm in there.
you're in the picture. Okay. And then we had 451 attendees, which was double what we had last year. So we were pretty excited about that. We gave away 52 bicycles. And Sun Country was very kind and came out and helped us with that. We had approximately 125 bike helmets given out to kiddos. And then they had a bike helmet fitting booth. And so if the bike helmets were free, we gave them to anybody who asked, and we tried to give them away to everyone. People had bikes. And then we had a bike fitting as well. Okay, so I was just going to share some of our pictures because it's pretty remarkable to see these kiddos getting free bicycles. We did not just address bikes and bike fitting. We also had the Temple Police Department was out there doing a bike obstacle course, teaching kids how to use their brakes, how to steer, how to go up and down a hill. And then we addressed a lot of other injury prevention things that we worry about. So you can see here, Lana is teaching Stop the Bleed. The next one is about being under the influence and how hard it is to walk under the influence, trying to teach people about that. We have a fire truck out there, which is always fun, right? There's another kiddo. We gave vests out, pedestrian vests, so that they could be seen on the road and talk to them about the importance of being seen. There's a picture just kind of the general doing out there. And then here's some of our officers from Temple Police Department helping us out, teaching the kiddos how to ride. Safely ride, I should say. Here's the picture of the volunteers. I was really impressed with this picture. These people did not get paid to be there, and we had that many people show up. So the event keeps growing. I know that in future state, the Central Texas RAC is very interested in partnering with us and making it an even bigger impact for kiddos. So we're super excited about that. So these are some of the booth topics that we talked about. Some of this doesn't have anything to do with this committee, but I just wanted to share kind of the subjects that we touched on. So pedestrian safety and ATV safety, and certainly fall and concussion awareness. So those are the things we really focused on this year. All right. This is our contact information. Anita can definitely share this. We have a shared box that we will answer any questions, or if you have any ideas, or if you would like to partner with us, you certainly can get in touch with us. And then that's our injury information How many questions?
I have a question about the scooters. Sorry, about scooters. Is that mostly just the push scooters or is it the electric scooters?
Electric scooters, what are those things that are not on, they don't have a pole at all?
Like those wheelie boards or whatever,
A
hoverboard.
hoverboard, yeah, the hoverboards, those are super great for toy makers, super bad for kids that can't control it or ride. Yeah, but it's a little of both. I would say what we focus, because we want to do injury prevention, it's really difficult to get safety information into the hands of kiddos that are buying cool toys on, cool bicycles, and it's really hard to make it cool to be safe also. And so that's our battle. That's what we constantly are trying to get parents and kiddos, that a child should always be wearing a helmet when they're on something that is moving faster than they can walk. It's a super important. And she's shaking her head back there.
I'm thinking of all the times when I was a kid growing up, and if I wasn't riding my bike without a helmet, I was skiing without a helmet. And that's another sport that you kind of looked at, you don't wear a helmet anymore. So the culture in skiing definitely changed. So it's the same thing. It's just making it part of that. That's just how you look when you ride a bike.
Right, exactly.
That takes me to my question, which is, are you guys paying for the helmets or is that a sponsored donation?
So the helmets that we had the last 2 years were provided to us through the Central Texas RAC. That's where we got them from. Actually, I was just talking, we're working on maybe a different way to get some helmets, but it is purchased through, we have a foundation at the hospital. It's the Safe Kids Foundation, and so we pay for the event through that, and we have donors that specifically donate to that foundation
Right.
for those things. So we also pay for car seats out of that fund.
Right.
I was just wondering if you could break it down for us and sort of describe how the kids win the bikes, how they move
Sure.
through the safety
So,
program.
yeah, that's great. So they check in at the front, and we had certain booths that we have identified by the data that we really wanted those kids and parents to go to see, right, based on the injuries that we saw. And so we had 9 tables that we wanted those kids to go see. So we gave them a card at registration, and they had to go to those tables and get that card stamped, and then they would turn that in at the end of the day for a drawing for those 50 bicycles. So we kind of forced them to go to those specific tables that we wanted them to. Now, there was a lot more tables. I think we had 22 total tables, but there were 9 they had to go to.
And KTMPO, we hosted the pedestrian safety
Yes.
table there. And y'all, it was just so cute to see these littles and their parents come through and learn about what it's like to really walk through a parking lot, that they're look both ways, stop. Some of them would say, I'd say, do you know what a pedestrian is? And they'd no. And so I'd tell them, you're a pedestrian. And then I'd teach them how to say the word. I mean, it was just so much fun.
It was a lot of fun. Yes.
Your 144 volunteers, were those employees or was it a mix
It was a
of?
mix. So we reached out to schools, high schools, and had high school students come in and help, which that's remarkable. That's remarkable to have high school students come in because that just spreads, right? When you have somebody that's not necessarily on our medical side, that they're doing something else. So they came, we had nursing students come out. We had lots of employees. Obviously, we had lots of employees that were there. Trying to think who else came out. Of course, the police were volunteers. Side Country was volunteers. Lions Club came out and volunteered. So a lot of community impact. Of course, fire and EMS came out.
And I'd like to just chime in on that because y'all provided the KTMPO table with, I think it was 4 high school volunteers. And it was just it was so engaging to teach them how to communicate to these littles. So that's what I was doing. I was leading these 4 high school students. And we were just we had a little assembly line going where they would introduce themselves, get the littles' names, learn, do they walk to school? Do they ride bikes? Do their parents take them? Then they would go to the next section and learn a little bit more about pedestrian safety. And then would all go all the way to the end where they got their card stamped and got their little swag for listening to our spiel. It was really
Yeah, we
awesome.
gave them lighted wristbands at your booth
Yes.
because it was right before Halloween, so we wanted them to wear lighted wristbands as they were given.
You said 2 events a year? So do you do the same event like fall and spring?
No, so we actually are going to move this event to the spring. We keep doing it in October, and now it's colliding with a lot of other stuff. So we're actually going to reset it to spring. So we will have to do some other events in 2024. We're going to figure out 2 other events. But the other event that we do is, and it's actually multiple events, is Stop the Bleed. We teach Stop the Bleed at schools. And that's kind of that same idea, you train the trainer, right? We're going to teach kids how to, and we really target high school kids. That's who we target for Stop the Bleed, and teachers. And so we target them because we feel like that those are going to be people that will know how to do that in the community. They're often going to be the first one at the scene of some kind of traumatic event. So that's what we Stop the Bleed is one of the other.
So I just sent you an email, but I think you answered the question. I heard you say that you did have police and fire at things. Are you working with Temple PD and Temple Fire
Yeah.
Department?
Yeah.
Awesome.
Yeah, we are. And actually, just to speak a little bit to that, we also have an opportunity to work with Officer Cody. He works at a school.
I don't know all the resources.
Okay, so he is a resource, and we're gonna start doing car seat checks and pedestrian safety at schools. We're actually gonna branch out into that as well. That's a new idea that we just tripped across. And it's actually his idea, and we're gonna partner with him to do that. So working on kiddo safety at school and in car seats. So we're super excited.
If you could you loop me in on that? I'd love to be able to just, because I work with our communications team, it'd be a great thing to spotlight.
Yeah.
And then I know our PD has a pretty good, shine show the good news,
Absolutely.
but yeah, let's
Yeah.
make sure you do that.
We are very much interested in partnering in the community. Very much so.
Awesome.
Sarah, when you said you were going to reset for 2024, does that mean that there will not be a bike event in
That is
2024?
correct, because in order to do one to spring, we would have to have it ready in 3 or 4 months, and that's not a thing.
So the next bike event.
It would be in the spring of 2025.
Thank you.
But I think that one, we are really shooting to have Central Texas RAC as a part of that, and it would be a little more robust, but still at McLane Children's.
Any other questions? Thank you, Sarah.
Thank you all so
Thank
much.
you
for
so
letting
much,
me
Sarah.
know.
Thank you.
Thank you, Sarah.
Is Ms. Davies online?
Yes.
So next discussion item regarding,
A presentation on the bicycle network analysis, and that is with People for Bikes, Miss Rebecca Davies. She's actually online. I'm sorry, David.
Oh, yeah, we thought you were talking about
Oh, I thought
you said Davis.
Oh, I'm sorry.
I do not see
Rebecca Davies.
Rebecca Davies.
She's not online yet? No. Okay, so we'll
I'm
give her,
sorry.
that's okay. She's gonna be catching up to us. I don't know, Dan, are you ready to present? I added 2 slides in from the policy board meeting this morning. So we're gonna just skip straight on down to Dan. And then we'll go back. Sorry, I didn't make that clear.
Sure, all right.
Would you like to use your remote? Or do you want me to do it?
Yeah, I'll grab it really quick. No worries, no worries. It wasn't, we are flexible today, for sure, so.
oh, there he is, Dan Paulson. He's with Kimberly Horn, and he'll be presenting the SS4A Safety Action Plan.
Sure. And I think, Anita, the idea was just to give like a little 5-minute update. Is that about right? You said you pulled a couple of slides out. Just to give a
Yes.
quick overview of the project.
Yes, and to really emphasize your card, which I have them at the front.
Perfect. Awesome. Yeah, and I've got some copies here as well. So my name is Dan Molson. I work with Killeen-Temple Associates, a civil engineer payment planning firm. We're contracted with the Central Texas Council of Governments and the Killeen-Temple Metropolitan Planning Organization to develop what's called the Central Texas Roadway Safety Action Plan. As part of that, we are going to be working with municipalities, counties, and the MPO and the COG to identify projects, strategies, priorities related to related to safety on the roads for all users, bicycles, pedestrians included, with the goal of one day eliminating roadway fatalities and serious injuries on Central Texas roads. So, yes, and that is something we can celebrate.
Yes, it is.
We want to get there. We've got a lot of work to do. From 2018 through 2022, just over 400 people died on roads in Central Texas and the 7 counties of the Sitka region. So there's a lot of work to be done. I want to just briefly talk today about some of the guiding principles of our plans development and just talk briefly about that. And then the big thing I want to share is, before I get into all this, I'm going to be able to hang around after this meeting. If anybody has any feedback they want to give about locations that are of specific interest to bicycles and pedestrian users of the transportation system, I want to hear about that. I also want to, we've got project cards that I'll hand out at the end of the meeting where you can go on and leave that feedback on our website too, if you aren't able to stick around and give some of that feedback today. So the USDOT is the organization that has established this Safe Streets and Roads for All grant program. It's a federal grant that the COG and the MPO have received to develop this plan. And based on this plan, projects that are identified as part of this plan, there's a separate implementation grant track as part of this program that could bring additional money to the region to fund and implement these transportation improvement projects. The safe system approach is what the U.S. Department of Transportation has adopted as the guiding ideology behind the development of these safe streets and roads for all action plans. And I want to talk about the 6 tenets of that safe system approach because they're a little bit different than what you typically think of in transportation engineering. And I personally think they're kind of a breath of fresh air because we're kind of almost looking at this through more of a public health lens when we talk about it and frame the discussion this way. So the first tenet, death and serious injury on our roads is unacceptable. The only number of people that we are comfortable with dying on our roadways is 0. 0 is the only acceptable number. And we need to find a way to get to that point because too many people are losing their lives or losing their livelihoods on our roads. 2, humans make mistakes. We can't expect humans to be perfect 100% of the time. So when we design our road system and when we design how we educate, enforce, we need to acknowledge that humans are not perfect. And 3, humans are vulnerable. We also need to acknowledge that, especially, and this is something that is especially true for pedestrians and cyclists, that there is a limit to, if they're involved in a crash, there's a limit to how much injury or impact a human body can sustain before a serious injury or fatality occurs. 4, we have a shared responsibility to address roadway safety. It's not any one person or any one individual or group's job. It's going to require a responsibility from both users of the transportation system, policymakers, elected officials, engineers, planners, emergency response, law enforcement. Everyone has a shared responsibility to make our roads safer. 5, safety is proactive. We aren't here to chase crashes. We aren't here to go spend money fixing something up after a fatality occurs. We're here to proactively identify where those problem areas exist and to get those problems addressed before those crashes occur, ideally. And 6, redundancy is crucial. What we mean by that is that we can't, just like we can't expect humans to always work, we can't expect the systems that we install to always work the way that we intend them to. So it's important for that when we design, we have multiple layers of safety built into the system so that if one element fails, that there are other elements in place to prevent the worst outcomes from happening. And related to that, I want to talk really quickly about sort of the 5 tenets that USDOT kind of, with this general approach in mind, that they see as really making this possible. We're talking about safe road users, so the behaviors that people use on the road. Safer vehicles. How can we make vehicles safer for the occupants inside of them and for other users of the road? Safer speeds. How can we reduce speeds in a way that reduces negative crash outcomes? Safer roads. How can we engineer our roads and our pedestrian and bicycle facilities differently and design them differently to reduce those negative outcomes. And then post-crash care. When a crash does occur, how can we improve the level of post-crash care that reduces the eventual severity of that crash? And so as we develop the safety action plan, we've got 8 required components that FHWA and the USDOT are requiring to be part of that plan. There's going to be a leadership commitment element. So the KTMPO board, the SITCOG board are going to need to adopt a resolution, a policy commitment to either an eventual elimination or a serious reduction in the number of fatal and serious injury crashes on roads in Central Texas. There's a safety task force that will be overseeing the development of the plan and will also be responsible for overseeing implementation of the plan once it's complete. We've done a comprehensive safety analysis that is currently with SITCOG and KTMPO for review, where we looked at fatal and serious injury crashes for the entire 7-county region over the past 5 years to identify hotspots, to identify systemic challenges, to identify the most common crash causes and crash types. We're looking at a lot of engagement and collaboration, so we're meeting with stakeholders from across the region. We're also conducting up to 16 public engagement events. We've done 4 of those events already throughout the region, and we'll be doing quite a few more over the course of the next year. There's a significant equity consideration component to this plan. We want to make sure that the projects and the outcomes of this plan, the things that are identified, are things that are going to benefit everybody, even the less fortunate. And then as we identify things that come out of this plan, we're going to kind of have 2 big buckets. One is the strategy and project selections. Those are like the location-specific things that we can approve. And 2 are the policy and process changes. How can cities, counties, the MPO, or the COG change their internal processes to better consider safety and better design for safety on our roadways? And lastly, progress and transparency. Once the plan is complete, it will be posted in a public location so that all can see it. And that governing structure, that planning structure, is going to be responsible with measuring progress on that plan and seeing if we're meeting the goals that we set as part of that goal-setting process as the plan is outset.
I think those are the 2 slides that I gave for you.
Perfect. At that point, I guess, can I take questions if anybody has them? Or
Absolutely.
any questions from the group on what we're doing and what we're looking to accomplish?
So there was a question for you, but I haven't answered the question that Gary came to the policy board this morning, and we talked about the fatality and serious injury rate. He answered a great question. What constitutes a serious injury? So I went and looked it up. Anything that incapacitates you, anything that prevents you from taking part in your normal day-to-day, going to work, recreation, cooking dinner. If you're unable to do your normal daily activities, that's an incapacitated, what they call serious injury. If you can tough it out and get through, then it's probably not incapacitated.
So something like a concussion or a broken wrist.
Sure. Severe laceration, if you're full of stitches and you can't.
Right.
Yeah.
I was wondering how they got the stats for that.
Yeah.
Because we see a lot of people come in and they've got broken arms because they got ran off the road. And that necessarily probably isn't reported. And it's one of those that, like, I'm always curious, and I've told Anita this, where does everybody get their numbers that they calculate this out for? And a lot of times, like, if I get ran off the road and I break my wrist, I go to the hospital, how's that tabulated in your account?
It most likely isn't in that case, because what we're pulling from is the Texas Department of Public Safety and TxDOT's crash record system. So if there wasn't a crash report filed, that data is probably not being represented in the base data. So, and that's why we're not just looking at the crash data as the sole thing that's dictating where we're identifying projects. We're looking to get input on, anecdotal experience where, yeah, this didn't make it into the crash data, but I still broke my arm here doing this. We want to hear those stories for sure. From, especially, I think that's most, anytime a car crashes into another car, everyone's worried about the insurance. So there's always a police report that gets filed. But if it's a hit and run that involves a pedestrian or a cyclist, a lot of times that doesn't end up ever getting filed. And so we need to know about where those crashes are occurring, and if the data set that we have for those vulnerable users matches the reality, or how much are we missing? What do we don't know? We don't know. That's an important question I just answered.
I know I'm not on the committee, but I have a suggestion.
Great.
So trauma centers capture that data and we submit it to the state.
Okay.
And trauma registries, and so the state actually has a trauma registry that captures, and we quantify injuries. There's an injury severity scale. We quantify injuries, so maybe a broken arm would only be a 1, but if you were severely injured, it would be a 15 or greater or something like that. So that might be a way to capture some of that data.
Would that trunk, is that database searchable by sort of cause, like vehicle incident?
Yeah, so dishes would have that.
Interesting. Thank you. I haven't heard about that before. Thank you.
Even if it was unreported, but they
If they
just
went
like,
to the hospital, yes, it would be captured.
Okay. Yeah, I hadn't heard of that option. Thank you for sharing.
what was that called?
Issues?
So the Department of State Health and Services, so they have a trauma registry. State trauma registry. So you can probably put in a petition or a request to query that.
Yeah, it says, is it available to the public, or do you have to?
You would have to ask their registrars to pull a report for you, and I'm sure there's a process for that, and I don't know what that is, but I know that people can collect that data.
And I'm glad you spoke up, because I was thinking, you're the perfect person here to ask that question.
Yeah.
I mean,
Yeah, so we collect all, the only ones we do not collect are non-severe injured, so you would definitely find those severe injured, and we collect where it happens. The addresses where those things happen, it's collected. Yeah.
Thank you, Sarah.
So that include, kind of like what you said up there with your falls, that's collected at the trauma. They were riding their bike and broke their wrist, and it'll actually.
Yep.
Okay.
Yep.
Super.
Okay. Thank you.
I don't know if you were here, Dan, when Sarah was talking about that event that they have coming up called Stop the Bleed.
I don't think I missed, I just caught the end of the presentation.
So I was just thinking about the post-crash care that you had mentioned in your presentation. And I was like trying to connect the dots with that event, Stop the Bleed. And so, Sarah, can you just like revisit that event a little bit, Stop the Bleed, and see if there's any place for it in post-crash care that would save streets and roads for all?
Yes, so the American College of Surgeons has developed the Stop the Bleed program for the layman to be able to come upon someone that's bleeding to death and stop it. And so that would prevent, that would get to your zero, because the best thing you can do for someone that's bleeding is to stop it, and that's how you get them to the hospital and save their life. So we do community events at schools and all over, and it's available for free on a website. So it's something that could be easily shared at a community level for people to take this course, or just you literally can go through the video.
Thank you.
it's worth mentioning, that was something that in the safety work we were talking about. You know, how the data is reported. And much as we did this morning, Mayor Lee and I kind of got in the weeds, kind of butted heads a little bit about, you know, what's bringing fatality numbers up, what's bringing fatalities number down, how fatalities for injuries. And the post-care came up is that one of the reasons that the injuries may be higher and the fatalities are lower, we saw this in the Army. Around 05, they started giving everybody tourniquets, teaching us how to use those little quick, I mean, if you're conscious, depending on your injury, you could put a tourniquet on yourself. Not recommended, but the fact that soldiers were surviving wounds that would have killed them just 10 years before. Now then it's tracked as an injury. And I think some of the same thing has happened in the transportation world with airbags, bike helmets. Okay, you might have been killed getting hit on your bike before. You had the helmet on, you survived, but now you have a massive concussion and broken limbs. So it falls into a different statistical category. And it's nothing to do with the project selection, it's post-care, it's that kind of stuff. So it's all these interlocking and overlapping. Yeah, all these tools.
And post-crash care, there are some projects overlaps. We haven't talked too much about this because these would mostly probably fall on a lot of TechStop type projects. You know, as part of this plan, we really focus primarily on local roads because TechStop kind of has their own safety planning process for on-system TechStop roadways. But one of the things that keeps coming up, obviously, about a huge safety hotspot where crashes occur and severe and fatal crashes occur is I-35 and I-14. And a lot of the focus on those roadways often tends to be traffic incident management. How do we reduce the incident response time and then the incident clearance time where somebody is seriously injured, they're taken to the hospital sooner. And what impact does that have on how many lives are saved if you're able to reduce that average incident clearance time from 90 minutes for a severe injury crash down to 45 minutes, right? How many lives does that save? I don't know, but there are programs out there that are typically have been piloted more in the larger cities of Texas, but TxDOT's shown a lot of interest in expanding some of those programs. Safety Service Patrol, for example, or heavy wreck or towing contracts to get roads cleared up more quickly when a large truck overturns, something like that. So they may not be the focus of this plan, but there's something that TxDOT's considering, and there's something that we might want to consider more broadly at the MPO level or at the regional level as something that may be able to move the needle in safety as well. I realize that's not super applicable to the bicycle and pedestrian side of things, but I wanted to bring that up just because we were talking about post-crash care.
Well,
That's
and
where
I
we see a
think
lot of that overlap. So.
it gets to where you're pointing at the policy and process changes. That, I didn't know your office existed until a half hour ago. Knock on wood, because I haven't been your customer.
That's right.
Or that database, that's phenomenal to know about that. So from a policy standpoint, now that we know that exists, now we can incorporate using that database into the crash analysis or and for other stuff too. So in terms of this plan and, closing the loop, make that part of the policy to continue to find cross-disciplinary collaboration. Work with the transportation folks, work with the hospital folks, work with the workforce guy that just walked through here.
Yeah.
Because I know he's had a part to play. They've done some stuff with giving out bike helmets. So I think from a policy standpoint, let's make sure we're not getting so stovepiped into our transportation world that we're talking to fire, police, the hospitals.
One of the things about that we want to figure out, and maybe the first thing to do is when we query that data, we kind of overlay it with the existing bike and ped data that's compressed.
Yeah.
See what the coverage rate is. See how one-to-one that data set is, or how.
Loop me in on that. I'm
very
gonna geek out on this.
I'm very curious about that because that's an important story to tell.
Yeah.
If Chris is missing a lot of those reports.
Yeah.
Well, and it's the same thing we've had, we sponsor a lot of bike rides. We've had people that have actually crashed, had the ambulance come out, get looked at, refused service for the ambulance. We took them home, then we took them to the emergency room because they had a concussion. And, I know you track it. I believe Scott White probably tracks the same thing, puts the trauma up there. But again, that data, there's no police report on it. Just, a dog ran out the road, guy flipped over the bike, crashed. Next thing you know, he's in the trauma unit in the ER trying to get it figured out. So, and it happens. I've got a guy that broke his arm when he crashed. He didn't hurt his watch, but where his wrist broke was where the watch hit the ground. So, but he didn't go again. He didn't call an ambulance. He just went into the ER. Or now I guess you could go one of the smaller facilities.
Walk-in clinics.
40,000 walk-in clinics now.
Some of those places can look at it as well. Some of them, it depends on if they're classified as a trauma center or not. And so there's a lot of rules around it. I will say, if you go into an ER though and you're sent home, that data is a little trickier to gather from the state. It's the ones that are admitted is the ones that we report up to the state. So.
Still, like Dan said, there may be
There's
gaps in what
probably
we've been using to assess the problem. There may be gaps in our vision that this could fill.
Yeah, and I really think the severity versus death, that question that you asked is, you could put a numerator on it and say this number equals severe injury, which we do.
Yeah.
We have a severe number. I have my cards too, so.
Because I would take.
Yeah.
So last thing I'll mention is we've got little project website cards. Has everyone got one already?
No, but they're at the front.
Yep, they're at the front, so feel free to grab one on your way out. There's a QR code there, and our project website's there. Folks can leave interactive feedback on our live map, or if there's a survey that y'all can take, we'll have information on upcoming public engagement events. We can schedule our next set of them later this spring. We'll also be posting any interim documents that we prepare as we do all the safety action plan out there once they're ready. So, other than that, happy to answer any other questions, and I'll be hanging around after the meeting if there are any specific safety needs that y'all have that come to mind for vulnerable users. We'd love to document those. Thank you for your time today.
Okay, thanks, Dan. So we're going to go backwards to the network, let's see, network bicycle network analysis with Ms. Davies. Rebecca Davies.
Yes, and Miss Rebecca Davies is with People for Bikes. She directs the People for Bikes City Ratings Program, which measures national progress towards building high-quality bike infrastructure and safe streets in cities based on People for Bikes bicycle network analysis software. She also supports People for Bikes broader research initiatives through analyzing data and communicating results. Rebecca holds an MA in geography and previously worked in software development, state politics, and technology education. She's passionate about transforming complex data into actionable insights. Let me get her to her first page and then we'll turn it over.
Great. Thank you so much. Really appreciate the chance to be here. Is my audio okay?
Your audio is very loud, Miss Rebecca.
Oh, okay. I can try to, I'm not sure, I can speak a little softly. I'll try that. Great. Well, yeah, thanks again for the invitation to speak with you about our city ratings program and for the introduction. So I manage our city ratings program at People for Bikes. And if you're not familiar with People for Bikes, we are a national bicycling advocacy organization. We're based in Colorado, but we have staff in various parts of the country. And we're also a trade group for the bike industry. So some of our work is more related to the trade group side. I am on the advocacy side. So I primarily work on street safety to support bicycling. Next slide, please. Or should I do the slides or have you got them?
Well, I've got them.
Oh, you got them. Okay, great. Thank you. So I'm just going to talk today about what the city ratings program is, our bicycle network analysis that supports it, and how to improve your city score. Next slide.
Sorry.
No problem. So our city ratings is an annual ranking of cities based on the quality of their bike networks. So when we're talking about bike networks, we're really talking about their transportation infrastructure for bikes. This is not a measure of the quality of recreational riding facilities. So it's just an important distinction. We're really thinking about what exists to help people get from where they live to where they need to go safely and comfortably. And we're also thinking about all kinds of users, including people who don't bike today, but would bike if they had safer ways to bike in their city. Next slide. And the way we define a bike network for the purposes of our city ratings is the connected system of protected bike lanes, off-street paths, slow shared streets, and safe crossings that enable people to safely and comfortably bike from point A to point B. Next slide. So this is an example of, this is just from our city ratings website, and I pulled up Waco because we didn't have any cities from your MPO in our ratings when we released it in 2023. So we'll change that. We'll make sure to get cities from your region in our ratings, but we didn't have that yet. So this is an example of Waco's page. Waco gets a score of 12 so the scale is 0 to 100. 0 is low and 100 is high. So 12 is on the lower end, but I'll touch on the next slide that that's not uncommon. So here is a chart of average city rating scores in our analysis, both for all cities, which are those darker blue dots, and then for the top ranking cities, those are those lighter blue dots. So you can see this 0 to 100 scale. The first line is median city scores, and the second is averages. So the average US city scores 23 out of 100 on our scale. So what that means is that, we collectively have a lot of work to do to build stronger bike networks in cities throughout the country. So as I mentioned, even though Waco's score is 12, it's not, uncommon given that the average score is 23. And if we look at cities that are toward the top of the rankings, those top 10, the average score is 55. So even cities that are progressing, have progressed faster than the average, still have some room to grow. And if we compare this to, I don't have it on this slide here, but if we compare these scores to scores for some of the places that are known for bicycling around the world, such as cities in the Netherlands, for instance, those will score in the upper 80s, low 90s. So it's a pretty high bar. This is a strict scoring system that's really saying, we want every trip, what does it look like to have every trip feel safe and comfortable to ride on a bike, whether that's with young children or elderly folks or anyone in between. Next slide, please. So now you might be wondering how we produce this measurement. What does that score mean? So the way that we measure a city's bike network is using software we developed called the Bicycle Network Analysis. And it takes data from the US Census as well as from OpenStreetMap. And if you're not familiar with OpenStreetMap, it's like Wikipedia in that it's a free and open database that anyone can contribute to or download data from, or information from, but it's a map. So you could go there today and say, hey, there's a bike lane on the street outside my house. I'm going to add it in OpenStreetMap because it's not there. And there's a little bit of a learning curve to using it. But fundamentally, it's an open resource, and it's been a really great resource for us to be able to conduct the same kind of network analysis for every single city. If we were to take individual city data sets from every city around the country, that would be a prohibitively large task. So using OpenStreetMap really makes this possible. Next slide. So this is an example of the kind of maps our network analysis produces when it's analyzing the network in a city. So this is actually from Albuquerque, just a snippet from Albuquerque's street network. So it's showing you all of the streets, and it's showing you in red streets that are high stress for bicycling, and in blue streets that are low stress for bicycling. And I'll talk in a little bit about what goes into stress. But generally it's things like speed limits and whether there's bike infrastructure, how many lanes there are for cars, things like that. So you can see there's a lot of these blue lines and then, the red lines. But if we take away the red lines, the high stress streets, we're left just with what is fundamentally the low stress bike network in this section of Albuquerque. And we can see that there's a lot of fractures here. So despite all these different roads that are low stress for bicycling, a lot of them are going to be neighborhood streets. There's still a lot of gaps. And so this means it would be hard for somebody to get from where they live to, say, the grocery store or their school or wherever else they might need to go. And this is a very typical looking kind of map for a city. And so here's an example. I added cities in your MPO to our network analysis. And to be clear, the city ratings, once a year, we line up all the results from our network analysis in a rank. And that is the city ratings, but it's all based on these network analysis scores. So Copper's Cove is here, and you can see the street network, and there's a lot of high stress you might be noticing. And one of the main reasons for this is true of most Texas cities, is that a lot of those neighborhood streets that would rank as low stress in our analysis, they don't, because the default speed limit on residential streets in Texas is somewhat high, 30 miles per hour. And our analysis considers that too high. So it rates those roads as high stress. And if it were 25 or 20 miles per hour, it would rate them as low stress, like what you saw for Albuquerque. So if you have also, I will add here, if there are any corrections you have to the data, like, hey, actually the speed limit on our residential streets is 25 miles per hour, please let me know and I will correct it in our analysis. Make sure it's up to date here. But otherwise, we just use the Texas default, which is 30. Next slide. This is another map that the network analysis produces, and we're back to Albuquerque here as an example. This is all the bike infrastructure that we can see that's pulled from OpenStreetMap. And the green are off-street paths and purple are painted lanes, and there's a couple other colors in there for protected and buffered lanes. And this is all the bike infrastructure we know of there. Next slide, please. But if we only look at bike infrastructure that is considered to make a road low stress, then some of that bike infrastructure goes away. And what that means is that in some places there technically are painted bike lanes, but in our analysis, they don't count as low stress because other conditions on the road make the street unsafe. So for instance, if you have a 5-lane road and it's 40 miles per hour and there's a painted bike lane, for most people, a painted lane is not sufficient for them to want to bike on that road. And it's not safe enough for them to bike on that road because of the volume and speed of motor vehicle traffic. So that's why some of the infrastructure that exists doesn't actually change a street to low stress in our rankings. Next slide. And this is an example from Temple of the bike infrastructure map. So if there's so we see here mainly there's a few different areas of off-street paths. Maybe these are parks, I'm not sure. But if there's infrastructure in Temple that's missing from this map, then that means we need to update OpenStreetMap, figure out where that infrastructure is, get it edited in OpenStreetMap so that when we run our analysis next, we can make sure we have accurate data. Next slide. And finally, this is one more map from our network analysis. In this case, it's Belton. And what this map shows with these kind of red and blue colors is that if you start in an area that's red, it's going to be difficult to complete very many trips to common destinations using only those low stress blue routes. In areas that are bluer, you can make a few more trips more easily that are low stress. So the goal is to get maps that are, predominantly bluer in color, meaning low stress, meaning more of those kinds of trips can be completed. Next slide. So to kind of go back to how we rate these streets as high or low stress and produce those maps, there's really 6 things that we focus on, or that I should say the analysis measures, and they're embodied in this acronym SPRINT. So this also relates to your last presentation about safe systems, because these are all kind of components of the broader safe systems approach. But this is a very infrastructure focused measure. So it doesn't consider other aspects of bicycling. It's really just focused on what exists on the street today. So safe speed limits. I'll just move through these quickly. Protected bike lanes is really important. Every city needs more protected bike lanes, especially on those larger roads. Next slide. Reallocating space. So in this image, you see an example of a place where a road was overbuilt and they were able to repurpose the street, which both, made it, provided other uses for the street, like parking and public space, as well as made it safer for travelers. Next slide. Intersections. This is a road in your MPO. This is one example where our network analysis would rate this as a high stress intersection if people were trying to cross from the side streets because it is a very big road and there isn't anything to stop or slow down the cars at the intersection. So next slide, please. Something like a crossing island would help here. And this is just an example of the kind of thing that in our analysis would turn that high stress intersection into a low stress one. And then a couple more network connections. This is just the idea that all of these pieces, these safe routes need to connect so people can actually use the network for transportation and not just recreational rides. And next slide, please. And then also the final T is trusted data. So this just means getting the data in shape so we know we're measuring the right thing. This is an example from Corvallis, Oregon, which updated their data in OpenStreetMap, and their score increased significantly just by getting more information in there, so it's accurate. Lastly, I'll mention that in order to get these different things in your city, so safe speeds, protected bike lanes, etc., we advocate for policies to improve bike infrastructure, and we encourage local advocates to support these policies in their communities. And these are our priority policies right now, which is funding for bike infrastructure, mandating complete streets, reducing speed limits, banning right turns on red for drivers, and adopting modern design standards. And you can read more about all of those policies and examples of where they've been passed at the link below in our legislative guide. And I think there's one last slide. Great, thank you. Yeah, and that's my email and the website for the city ratings. And yeah, I'd be happy to follow up and make sure we've got accurate data for your cities and the MPO, and add any that we don't have that I haven't added to our network analysis. Make sure they're in there too. So I'm happy if there's time to take any questions you might have.
Any questions? Rebecca, on the infrastructure stuff, how do you guys work with somebody like a local person that wants to improve the infrastructure on helping legislation get passed? And that's also kind of goes towards the KTMPO planners in the room. How do we change that if, now for walkers, if you build on a major street, you have to put sidewalk in. Like over on this street, they're building that subdivision, they had to put sidewalk in. How do you get the advocacy to change the city policies so that they have to implement that in the planning process?
That's a great question. And some of my colleagues are working on a sort of sister program called the Great Bike Infrastructure Project. And it's very focused on exactly that. Like, how do we help, how do local advocates get these policies passed in their communities? So we have a few different resources I'm happy to share. But it is a process of, knowing, building up the advocacy base of, knowing who are the decision makers and identifying, the policies that you want to work, really focus on, because it can be hard to tackle a lot at once. Yeah, but I think what's great at this point is we have more and more references from other parts of the country where they've passed versions of these policies that have been successful that we can learn from, or learn from ways, if they haven't been successful, learn from that too. So I think there's a longer answer to your question, but I'd be happy to follow up with some resources from our sister project that provide some more guidance on how to get those policies passed. It can definitely take time and building knowledge and political will, because a lot of it comes down to political leadership and commitment to making roads safer in your community.
And then for your analysis on the cities and towns, is a multi-use path, if it's a walking bike path, that counts as a bike path then in your analysis?
Yeah, like a multi-use path.
Yeah, because I know Temple pretty well, and I know we have a lot more than what it shows. I know Belton does too, so it'd be interesting to, help you guys with your maps and improve that. So.
Yeah, and I'd love to work with anyone who has, information about the infrastructure there to improve the map. So yes, like multi-use paths would be included as long as they're big enough. So I think the metric in our analysis is 8 feet at least. So that would mean sidewalks that were really just built for pedestrians only wouldn't count, because they're often less than 8 feet. But if it's a bigger path and it does allow bikes, then that would count. Yeah. So yeah, let's definitely make sure we've got all that information in OpenStreetMap, and I'm happy to help with that.
All right. Anybody else? All right. Thanks, Rebecca.
Thank you, Rebecca. We appreciate you.
Yeah, thank you. I appreciate your work.
Forward real quick. We got James coming up with something near and dear to everybody's heart, the project call subject scoring process, which I think everybody got an email that's involved already. And now, hopefully, you're going to give us an explanation, a little bit of craziness. So go ahead.
Would you like to?
No, just a slide, I think.
Okay.
I'm good.
Okay.
Yeah, well, Jason's familiar, so.
I can fill in the gaps as needed.
I'm really here just to answer questions. Hopefully the email I sent out was clear enough, but we had a project call, a bunch of project applications, and 36 of them were for sidewalks, bike lanes, other active transportation type projects. And earlier this year, we were discussing, looking at the scoring process. The TAC was interested in making sure the BPAC was involved. I should say Jason led that. It's like, hey, we want to get the BPAC involved, especially for the livability type projects. And so what they kind of decided was having the BPAC work on the subjective scoring part of the process, which is really just means looking through those applications that were sent out and that spreadsheet I sent with the different categories. I think it's fairly clear in there, like if a project does X, Y, Z, it can get 1, 2, 3 points or whatever. I mean, it spells out what a project needs to do to get the certain amount of points, but there's some flexibility, subjectiveness, I guess, which is why it's called subjective scoring. And someone may think this one does a better job at this one category than this other one, like it's better at filling gaps than somebody else. So really just, it's the first time we're doing it this way, and I know the TAC is more familiar with it, but the BPAC not so much. So there were questions about how to do that, and I know we don't have everybody who I send that email out to wanted to be here to provide comments and further explanation as needed.
And I'm sure your email explained it very well. I don't read emails very well.
That's fine.
I'm more of a visual. So when you look at that chart, so everybody that you send it to is going to do the rating for 36. And how are you guys going to correlate from that into determining how it's going to rate? The final number?
So we have a spreadsheet, and basically we'll just copy the scores and we'll put them in the spreadsheet and in different tabs, and then the spreadsheet will average everybody's score. So for like category 1, subject to category 1, it'll add everyone's scores up, divide it by the number of scores, and get an average, and that's the score for that category project. So like if everyone gives it 5, it'll get 5 points, but if half the people get 5s and half the people get 1s, it'll get 3 points. It just, or whatever.
However the math works.
However the math works out.
Okay. That's
Yeah.
what I figured. Yeah. So what's you sent out 100, I don't know how many emails you sent out. What's your success if you only get 2 people to respond or 3 people to respond? What do you got? Is that what's going to be the rating?
It will still be averaged.
Yeah.
And then so when we did this last time with BPAC, we just kind of went down the list and said,
Top 10.
1,
I
2,
think
3,
we did
4.
the
These
top
are our top 10. These are the ones we want to see funded.
Yeah.
But it wasn't scored per se, it was just a ranking. And that was offered to TAC to look at, take it, leave it.
Yeah.
So this time, you'll be doing the scores very similar to what TAC does. It'll be average. And then that'll provide the ranking. So once he does all the averaging, then we'll see which projects scored the highest on the subjective side. That gets combined with the objective score that they run. They've got a consultant on to do, how does this compare to the average crash rate? How does this compare to whatever, objective metrics that it gets looked at? Is it physically connected to a school? Is it next to one of the special activity, we call it, special generators?
activities, like schools or stuff.
Right.
Like that. Yeah.
That it's not a subjective, it's kind of like a yes or no. So then the objective and the subjective get, that's your total score. And that's where the ranking, so that the BPAC scores can be looked at. If BPAC comes up with a drastically different ranking on these livability projects than TAC does, then I'd like to think that would start a conversation. Okay, why did BPAC rank Salato's project way up here and everybody else nuked it? Let's talk about that. Let's make sure we get it right and we're getting everybody's perspectives.
Yeah, that was kind of the idea.
Oh, yeah, I mean, you just gotta walk down Salado, walk through Salado right now, figure out what they need with the Christmas thing going on.
Yeah.
So, yeah, okay. So it's just, I'm trying to generate more feedback to get more people to respond to that email. I know I haven't done it yet. It's on my agenda to do, but the more input you get, like you said, we're gonna be able to, as the BPAC, actually have an influence with the TAC and then the planning committee, the policy committee, because I was at that meeting, that was actually a really good meeting too. But get the conversation going so we can actually, as hikers, bikers, walkers, runners, whatever, make that change overall in the community by starting that conversation, because, I always put it this way. Everybody raise their hand that does a walk or a hike or ride their bike to work. And in the policy meeting, you probably got maybe 1 or 2 people. Yeah, so are we getting the right people? And I think the BPAC is supposed to be the right people to rate that and start that conversation. So, to try to
Because
get more
ultimately what it
involved.
comes down to, we can talk about this all day long and feel like we're solving the world's problems. If we're not putting money on a project, what have we done?
And the right project. too.
And the right project, and that's where the scoring process is so important.
And if it would be helpful, I know there's not everybody here, but if we're hearing feedback, that would be helpful to have another meeting where we kind of just walk through some. Everybody can bring their laptops or whatever, and staff can help, or if we're here to assist, because it's the first time.
I mean, I think your email, that would be great if we could get a lot of people involved. I know I've been coming here for about 6, 7 months, something like that. I know the involvement fluctuates depending on what's going on. But getting people involved in that structure and getting the feedback, because I mean, honestly, you guys do, as a BPAC, do have a way to influence the community by saying, you guys in the TAC are completely wrong about what you're thinking about where you need to put this bridge for pedestrians or whatever. We're the pedestrians and the people that actually do that kind of stuff. You know, the overpass over 190 so I don't get killed going to work on 5th Street kind of thing. You know, that's been my big project. So just stuff like that. And you get the community involved in it. And I think I don't know how many people we have, 30 or 40 people.
And I know, Jamie, if somebody wanted to call, I'm sure you would walk them through it. And I'll send the offer too, if anybody, wants to reach out to me, I mean, I've been doing it long enough. We talk through if you got a project and you're trying to figure out, should I give this 5 points for being next to a school because the school is a half mile away? No, if you only want to give that one 4 points, that's the whole point of the subjective score. I had a few, and I'm just thinking because I was working on my tax scores 2 days ago. There were several for the schools that I looked at how closely this comes to a school. Is it a direct connection, or is it there's a sidewalk from the school and this will connect to that sidewalk? Okay, you're getting some points, but not the full. Is the school a mile away? You're probably not getting any points. If there's not going to be a direct, in my mind, if there's not a direct benefit for people trying to reach that school using the facility that project would build, probably not scoring you high for school. I may score you high for something else. And the projects that score high across all the categories are the ones that rise up. I mean, there was a couple, I won't say which, but there was a couple I was surprised I scored as well as I did. Hey, good project, good project.
Excuse me, James. So how many BPAC members are eligible to do that scoring?
I sent it to everyone who was in our contact list for voting members, and I know our list may be a little bit outdated, so I think to keep it simple, it's voting for TAC, it's voting members, so.
And for BPAC, it's voting members?
Yeah, it would be
And then what's the deadline for that?
January 19, something like that. I put it in the email.
Yeah,
I'll send
I think it was January 19th. Yeah.
You'll get a follow-up too from me at some point.
Oh, no, I'm doing it this weekend, so.
Well, everybody will probably, so.
No, I just think I think this is going to the policy, and the general public, you don't go to that policy board meeting or the TAC meeting or this meeting. I mean, I've learned so much just by going to those 2 meetings, and this is the first time I went to a policy meeting. I mean,
You're a good one today.
yeah, you got the chance as a public person to come to a meeting and every mayor is here. Like, if you're not happy, the mayor's right there. We're not running out of here.
Yeah. Even you had the Cove City Manager, the Belton Mayor, Temple City Council. You get, and yeah, like you said, speak to the folks in power. If there's a project that didn't get submitted, That feedback is just as important as the ones that did get submitted.
Anybody else? Okay, next thing regarding public input, I believe.
Local update on bicycle and pedestrian activities. This month, we'd like to highlight the Baylor Scott and White Hospital Network Walk with the Doc events. We have one on Saturday, December the 16th in Harker Heights at Miller's Crossing. And on that same date and time, another one in Temple at Miller Park. And these really promote walking and overall good health. You're going to be walking with a different type of provider and be able to ask questions regarding their specific scope of care. And so it's a great opportunity to get out there and walk off some of those chocolate chip cookies for the holidays. And also we want to highlight Texas State Parks. We're wrapping up our 100-year celebration. And just a big shout out to the Texas residents who voted in a $1 billion Centennial Parks Conservation Fund. And that's going to really make a difference with our state parks coming up. And be sure to mark your calendars. Our state parks are going to be hosting a first day hike on January the 1st of this year. There's going to be all types of opportunities all throughout the state of Texas, whether you bike, paddle boats, or ride horses. You can even hike the state park. Kick off 2024 with excellence.
I'll just add in, if you don't want to do the walk, Syntex is letting in their last run this weekend. And you can go run a half marathon if you're really up for it. So I think it's in Killeen. Sure. Next, do we have any member comments?
Oh, I want to just,
Go ahead.
there's one more thing I want to highlight. BPAC has a fitness-friendly business program, and it sort of has, we really haven't been engaging that program in the last 18 months. And so KTMPO staff recommends that we begin the process of refreshing that, looking at if that's something that we want to continue, what do we want it to look like, who do we want to highlight. And so as we move forward, be thinking about that, please. And as always, you can continue to follow us on social media. Our big social media page is Facebook, and also all of our meetings are on YouTube. So we'll be highlighting these meetings on our YouTube channel as well. You have any questions about local updates? Then we'll move on to our public comments. We received public comments through social media. We have a new update on our KTMPO website. There's a public comment link. You can go up there and submit a public comment. It's very easy. Highly recommend it. It'll be submitted directly to KTMPO staff. We take those public comments, much like these right here, and we respond. If the user wants information back, we'll respond back to the user. We'll be sure to include it in our public comments received here. It's posted on our TAC policy board, Freight Advisory, and BPAC. We also forward these comments out to the proper jurisdiction and make sure that they're aware of those issues as well. Any questions about public comments? Any member comments?
Guess not. No member comments. The next meeting is going to be March 13th, 9:30. Before I adjourn the meeting, I just want to tell I just started this job. I'd like to thank the KTMPO people. They've done an awesome job keeping me informed, and then the job that they do, I don't think they get enough thanks for what they do, but just working with them for the last month or so has been pretty cool. So yeah, anything else? We'll adjourn the meeting at 3:51.
Thanks, everyone.
Thank